Megan Trainor on 102.7 Mom FM on your station playing your hit music. It is WMOM, and in the studio with us, Jessica. How you doing, Jessica?
I'm doing great. I love this sunshine. I'm happy to be here.
I know. Okay, so I keep asking people, are they warm weather people?
Yes.
Do you like it toasty hot, or is this comfortable? The temps are out there right now.
I like it toasty hot with no humidity, so I don't really know why I still live in Michigan, to be totally honest.
Absolutely. I remember a few years back, and by the way, we're Jessica Thompson from St. John's Home Healthcare joining us here in the studio. I remember I went to a running race in Atlanta, Georgia, years ago, and I was in the shade, and I was sweating bullets.
Yeah.
It was man, it's hot.
It's like 100 degrees in the shade.
Yeah, it's crazy. Anyway, thanks for coming back into the studio with us. We're going to be talking over the next couple of minutes here on Mom FM about hiring and healthcare. And something that if the listeners are interested, they can watch this segment on our Facebook or our YouTube channel. You can also listen to it at WMOM.FM. Just click that play button. We're streaming on your smart devices like your Amazon Alexas, your Google Home, and right here over your radio too. Jessica, the act of hiring, I guess the first question that comes to mind is that is healthcare just like every other business right now, where you just have to continuously be out there looking for candidates, and it is like that needle in a haystack sort of thing? It
is, and prior to the pandemic, there was already a deficit of nursing, and then there's been a small exodus of nurses from the healthcare field. And so we are seeing a resurgence of newer nurses and even some older nurses coming back into the field. Took off maybe a therapeutic year and took some time to gather themselves.
COVID stressed them out.
It was a stressful time. I would say especially for our healthcare workers that were in the hospital setting that saw multiple cases a day, and it was. I don't want to use the word trauma lightly, but it was a little bit of a traumatic experience for some of them. But we're starting to see some of these nurses who have taken some time off and healed, and they're coming back to the workforce, and we'd love to have them a part of our team.
Do you see that if they're starting now, it's going to take a while for them to kind of, obviously education takes a while.
Yeah.
But, we've got West Shore Community College right here in our backyards.
And MCC down in Muskegon.
Exactly.
Close. Yeah.
And so if somebody's looking to get into the healthcare industry, in particular, and work for St. John's, and they start now, is that the conversation that you're then having with them 2 to 3 years ago, or can they get their foot in the door earlier than that?
They can get their foot in the door earlier than that. We have cases that we hire for aides. So those are, non-certified nursing assistants.
Okay.
Like CNA is a certified nursing assistant. And if they're going through the program, we love to work with our students that are going through the nursing program and work around their schedule. It gets them really good hands-on experience. Some of our cases require, it's called a 48-hour case, so 24 hours of nursing alongside of 24 hours with an aide. Okay. And that's such a great environment to learn from, because you have a nurse who's skilled and has a lot of history in the healthcare field, and you get to learn alongside of them and just see things that you might not otherwise be exposed to.
Absolutely. If you're just joining us, so we're talking about St. John's Home Healthcare, located right there on Washington Avenue, North Washington.
North Washington, right across from the new addition going on to the high school there.
Very cool. Yeah. And at that facility there, because we talk about you have locations or needs in multiple areas, but I wonder what if people do know what happens there at North Washington. What happens in the buildings there?
Well, we have 3 buildings there now. We have our main office is here in Ludington on North Washington. That's our original office. And that's where just sort of the chaos of everything behind the scenes happens there. Our HR department is there, billing, payroll, all of that is there. Our nursing managers are primarily there.
Okay.
The building to the right of it, just south of us, is our St. John's house. That's where we have clients who have private duty nursing or private duty aide, and they are there with their own staff in each room. It has a general kitchen and dining room and living room, but otherwise everyone has a private space.
Okay.
Private home, or a private room, excuse me. And then our primary thing that we do is we send nurses out across the state of Michigan into our clients' homes to care for them in their home, and that's called private duty nursing as well.
All right. And that's a bulk of the work, right?
That's primarily what we do. I'd say we have about 35 clients in that arena, and then we have another 4 or 5 in St. John's House.
So if somebody's interested, and by the way, we want to make sure that people understand this too, is that this is a very flexible position, and I know you and I have chatted about this before. How flexible is it, though?
Well, it's great because one of the appeals to healthcare in general is that you work 3 12-hour shifts and then you have 4 days a week to do the rest of your life. And I think that is a valuable part of the healthcare industry because it allows you a better work-life balance instead of working, 5-10-hour shifts and you just can't get to the doctor's office in normal time and you can't go to the dentist for your regular cleaning. You have to work your life around work. And in our industry, we primarily have 12-hour shifts. There's a couple exceptions, obviously, to that rule. But it does allow you that work-life balance, and that's a valuable thing in our world right now.
Yeah, and I think that is more people are looking for that opportunity. And I would assume in the hiring process that is part of the conversation. What is my job role, but also how much time can I spend at home versus how much at work.
Right, because we all have kids, we have dogs, we have sporting events, we have family things, we have the holiday. I mean, we live in Ludington, so summer is just in and of itself a great time to go to the beach and do things with family and friends. So allowing people to have that balance in their life, I think, is invaluable.
Take us back for a moment, and if you're just joining us, we're talking with Jessica from St. John's Home Healthcare this morning. Take us back to if somebody's in college or here for the summer, is there opportunities there?
Yes.
That's temporary, though, right? In some cases,
it's a little temporary. Yeah, with our college students, we do our best to work around their work schedule or their school schedule. Excuse me.
Yep.
Like I said, it's a great opportunity to get experience and exposure to things you might not otherwise see in the healthcare industry in different settings, I should say. And we, like I said, we work really hard to work with those students around their schedule. One of the things that we love to talk about also is we're always open to like a PRN position. So what we were talking about earlier, if for instance you work at the health department in Ludington, you work a really steady 9 to 5 Monday through Friday, but you want to pick up a weekend somewhere where you get that hands-on, very direct nursing care. We would love to take someone on board. We have several nurses that do that. They work a 9 to 5 like desk nursing job. And then once a month they pick up a Saturday, Sunday just to get back in and flex those skills. Our skills are a muscle. Flex that muscle and just get the hands-on experience.
All right, love that. And there's nothing wrong with picking up a little bit of extra, especially extra income coming their way.
That certainly doesn't hurt.
Yeah, absolutely. Can it be? Can it fill the pocketbook? Can it be a lucrative job in healthcare right these days?
Healthcare in general is a lucrative endeavor. Yes.
Okay. All right. So somebody that is interested in obviously exploring healthcare, working a flexible schedule, or if they're like, hey, I want to dive right in, you have positions there for that. We do.
Yeah. We have full-time positions on days and nights here in Ludington as well as in the Muskegon area, and then kind of everything in between.
Okay. All right. How far of an area is this? So if somebody's like has a relative across the state or in the middle of the state or somewhere, and they're like, "Hey, this might be right up their alley."
Sure.
What are we looking at? We
go into the east side of the state as far as like Cadillac, Reed City area, and then all those little like pin drop towns around there. We go that far east, and we go as far south as Grand Rapids.
Okay.
Right now, we go as far north as Ludington, but in the past, we've gone to Manistee, Kalkaska, Traverse City.
All right. Sounds
further
good.
North.
And hiring right now. Like if somebody called you up and said, I would like to sit down, there's an option for them.
We would probably get them in within 24 hours for an interview.
Wow. Okay. This is fantastic.
Yeah.
Anything that we missed talking about today that we want to express to our audience here?
I think that's it. We're just we're very open to anyone coming in for an interview. If you're an aide and you don't have a ton of experience, but you have a passion for healthcare, we'd love to train you on the job. If you're a nurse and you've just taken that year off, that hiatus to heal from some of the things that maybe you've seen or dealt with, we'd also love to bring you back on. It's so much more chill. You get one-on-one direct care. You have one client. You take care of them for 12 hours a day, and you really do connect and become like family. So anyone that's out there looking for maybe a different change of pace, we'd love to have a conversation with them.
That's pretty cool. How can they reach you?
2 ways. You can look at our website. It's stjohnshealthcare.net. There's a portal on there for new potential employees. You can fill out the information there. You can also call us and ask for Molly. She's our HR person, and that phone number is 231-845-7922.
All right, sounds good. Jessica, we appreciate you coming in.
It's always a pleasure.
Absolutely. We'll check in with you next month. Sounds like there might be some new, some cool news to pass on.
There might be some new stuff happening.
All right, sounds good. But if you are in the healthcare industry or looking to get into the healthcare industry or expand, give St. John's Home Healthcare a call today. Reach out to them. Jessica, thanks for coming in.
Thanks for having me.
Absolutely. 9:37 now on 102.7 Mom FM. Stick around. More music on the way here on Mom FM.